The HALT IT Trial. Welcome to the Everything Surgery podcast, where we dissect the extraordinary. Today, we are presenting an in-depth and formal discussion of the HALT IT Trial, a pivotal study that explored the effects of tranexamic acid on patients experiencing gastrointestinal bleeding. Let us begin with the essentials. The HALT IT Trial, officially known as the Hemorrhage Alleviation with Tranexamic Acid Intestinal Bleeding Study, was published in 2020. It involved a substantial cohort of 12,009 adult patients who presented with acute upper or lower gastrointestinal bleeding. Participants in this trial were randomly assigned to receive either intravenous tranexamic acid or a placebo. Now, turning to the key findings. The trial demonstrated no reduction in mortality associated with gastrointestinal bleeding when tranexamic acid was administered. Specifically, the proportion of deaths due to bleeding was nearly identical in both groups, with 3.7% in the tranexamic acid group and 3.8% in the placebo group. Additionally, tranexamic acid did not lead to a decreased need for blood transfusions, surgical interventions, or endoscopic procedures. Of particular concern was the evidence of harm. The study found a significant increase in the risk of venous thromboembolism, blood clots forming in the legs or lungs, among those who received tranexamic acid. The incidence of these blood clots was 0.8% in the tranexamic acid group compared to 0.4% in the placebo group. In conclusion, the HALT IT trial provides clear evidence that the risks associated with tranexamic acid, particularly the increased likelihood of blood clots, outweigh any potential benefits for patients with gastrointestinal bleeding. As a result, the routine use of tranexamic acid for this condition is not recommended by current clinical practice guidelines. Thank you for tuning in. If you appreciate our content, please like, share, and subscribe. This has been the Everything Surgery podcast, where we continue to dissect the extraordinary.